is sponsoring a workshop called the MSM Symposium. And what it is an all-day workshop, which is going to consist of, and here, I have the agenda, and what it is reaching out the masses, effective ways in reaching gay, bisexual, MSM, and transgender populations. Still here at the MSM Symposium. Now the day is getting started, so we're going to check out the first workshop, which is reaching the masses, effective ways in reaching gay, bisexual, MSM, and transgender population. The class is about to start, so come on, so let's check it out. Being greater than means rising above. Education beats fear every time, so the more we can reach out to people and let them know that they are empowered. If they get their status, they'll want to get that status. So it's a grassroots movement to spread education and awareness that this isn't a death sentence by far. And we're back. We're sitting down now with John Diggs.
Absolutely.
Great. John, if you could just tell our audience a little bit about yourself and what brought you here to the MSN workshop.
Yes, I am a prevention specialist with Aid Atlanta's Evolution Project. I have the privilege of working with gay black men ages 18 to 28 and reducing their risks in transmitting or acquiring HIV and STDs. And while I work with 18 to 28-year-olds, I have the privilege of servicing all communities, all age groups, all ethnicities.
And what made you get into this field?
I think when I walked across the stage after graduation, I noticed that some of the friends that I came in with my freshman year were no longer there. And I thought it was due to financial aid, navigating the HBCU financial aid. But it was this silent killer that no one was talking about. And I had a psychology degree, and I wasn't really for sure what direction I wanted to move in. And so I said, this is it. How can you have a social services degree and not deal with one of the most predominant issues amongst gay black men?
Exactly. So I know that you're one of the panelists in one of the workshops.
Yeah.
So what role are you playing in that workshop?
Yeah, I'm still trying to figure out why I'm here and why they called me, because I feel like I'm doing what everyone is doing, and I don't think there's anything special about how I do it, but particularly I'm discussing outreach among gay black men and transgender and other communities.
We've noticed that we've been to a couple of events here in Atlanta, Georgia, as well as out of state, and we're noticing that all of a sudden, I don't know if it's all of a sudden, but I know for us, we've been hearing now a lot about the transgendering world, because they are part of the gay community. How is that affecting what you do? How is the transgendering community coming into effect with what you do?
Absolutely. A lot of times we see amongst our youth in particular, the sexual landscape is changing. And my work is really with adolescents and navigating the question of who am I? And sometimes I see where it could be just getting to understand who they are. So maybe it's just a part of them that's responding to wanting to present as the other gender.
Okay.
And then I actually come in contact with folks who've made the decision that this is how I feel, this is how I want to present. And a lot of my work really focuses on how to navigate life as a transgender person. Like just basic things like ID. When you're carded, how you present as one thing and it's something else. Conversation from the government level all the way basic to cashing a check. Like how difficult that could be. Even choosing what restroom to go into, afraid that you might be clocked.
I never even thought about it even on that level.
Yeah.
You just brought up some baby, say, I didn't even think about it like that.
Yeah.
That's true. Now, when you say adolescence, now that we're reaching the end of 2012 and going into 2013, what new ways are we're trying to what new ways are we trying to come up with to reach adolescents or the younger generation compared to 5 years ago? How we're getting them to pay attention and to do what they need to do to reach adolescents?
I think two things is happening right now. I think on a government level, we're recognizing that a message of abstinence is not so much a blanket response to reducing HIV/STI infection. I think what we're noticing now is that youth or gay men are having their first sexual debut as early as 13 years old, and certainly the data supports it. The new HIV infections are up 87% among those 13 to 24. And I think there is a behavior risk assessment that each state usually has. But in Georgia, we have removed the sexuality piece from it, the sexual practice and behaviors. So we're working in a state with these increased numbers of HIV, but we aren't able really to capture the numbers like we need to.
Okay. Now, even sticking with the subject of adolescents, we noticed that we've been hearing that the numbers are higher in the African American community. Is it the same even with the adolescents, that the African American youth are more affected than white?
87% increase. The CDC just released the information on World AIDS Day. And while they, some of the information is saying it's happening from older partners, having sex with younger men, but I don't want to demonize those types of relationships because those are valid as well, if they fit in our legal code, so to speak. But I also know youth who seek out the company of older gentlemen, but they haven't had conversations about how to navigate putting a condom on when I'm dating someone who's older who may have power over me, so to speak. And what I mean by power is housing, food. I have someone who loves me for me. And sometimes putting on a condom means, or not, how could I say, not wearing a condom could sometimes mean I have access to these resources or I don't.
Is there any other way that outside of saying wrap it up, put the condom on, that we can start trying to maybe perhaps get in the heads of the youth? Even
Yes.
adults, if for that matter.
I definitely support a family approach to the epidemic because we must start dealing with the infection before the infection. And what I mean by that is the stigma that's associated with it. So how do you have a conversation now about sexual practices when you as a parent yourself are kind of put off about the gay lifestyle?
I have to agree with you with that. It starts with communication, and we need to start treating it just like you would with anything else, as far as telling our daughters about not getting pregnant.
Absolutely.
Or our sons not being a young father. It should be put right into that conversation as well.
Absolutely.
And instead of saying birds and the bees, being real.
Absolutely.
Being real.
But not only from a consequence perspective, but just because it's your body, protect it. It's your temple.
Well, we're running out of time. I just want to say thank you so much. I know it's a busy day for you today. You're going to do, what, 3 workshops, right? It's a total of 3?
Yeah, 3.
So thank you, John, for sitting down with us. We really appreciate it.
No problem.
Urban Socialite appreciates it. And then we're going to continue on finding more people to sit down with so that you can get a little bit more insight as to the workshop that's going on today. Thank you.
It's not a black thing.
It's not a white thing.
It's not a gay thing.
It's not a straight thing.
Testing for HIV is everyone's thing.
New OraQuick, the first in-home oral HIV test. Now you can test yourself in the comfort and privacy of your own home and get results in 20 minutes. It's the same test healthcare professionals used for years, but now it's available on the shelf at your local retailer. Don't use OraQuick earlier than 3 months after a risk event or to decide on behavior that may increase your risk for HIV. If your activities put you at risk, test regularly. A doctor, clinic, or healthcare professional must confirm a positive result. New OraQuick. Buy it today at your local retailer. Knowing is the best thing.
And now?
It's my thing.
Good afternoon. We're sitting here with Dr. Hawthorne, who handled one of the workshops this morning. Introduce yourself real quick.
I'm Kenji Hawthorne, physician, internal medicine specialist, as well as infectious diseases.
And tell us a little bit about the workshop that you he just finished with the workshop, so just give our audience a little bit about what the workshop was about.
Well, the name of the particular session was Gay Men's Health, to discuss, various issues related to primary care, disease management. I chose to talk about one of the, probably hottest topics and probably more controversial topics, and that's the discussion of HIV pre-exposure prophylaxis, which actually has been tossed around for a number of years. We've been fairly accustomed to providing care related to post-exposure prophylaxis, but this is sort of a new realm that we have stumbled into, and it carries a lot of potential concerns and issues.
And for us individuals who are not doctors or who's not familiar with prophylaxis, could you give us a little bit more on what that is?
Yeah, so prophylaxis is basically any measure including dispensing medication, any kind of barrier protection that basically helps to prevent the onset or exposure to a particular pathogen or chemical. So perfect example, something that we're very familiar with is the use of condoms. For many years they were labeled as prophylactics, which was to help to prevent sexually transmitted infections.
Okay. I know that you mentioned also in your presentation, you were mentioning about the signs that sometimes individuals might get in regards to letting them know that they may have the HIV. What are some of those signs again?
Okay, so that's called the acute retroviral syndrome or acute HIV seroconversion syndrome. Some very common symptoms include rash that they would notice all over their body, which can look like other things other than HIV. The other symptoms pretty much are like a typical sort of cold or flu illness. So sore throat, they may have a cough, they may have a fever, muscle aches, pains, that sort of thing. So it's a constellation of symptoms that can look very much like other types of viral infections.
And you also gave a video presentation on how the viral cell attacks the body or what have you. Is there, have we narrowed it down as to how long that process takes once a person is infected halfway?
Well, there's some information, some literature that suggests that it takes from the time that HIV is brought into the system and enters the lymphatic system, it takes probably about a week for the whole process to kind of come to fruition, and then it's the extreme high viral load that often leads to the symptoms that I mentioned. So it can take about 3 to 4 days for it to reach the regional lymph node, and then before it gets into the blood, about a week, and then it multiplies and can take up to about 2 weeks before you have symptoms.
Okay, great. And we also been hearing about this, I guess we can call it a super pill by the name of Truvada. How is this pill different from any other medication that has been put out so far?
Well, Truvada is similar to a couple of other medications, and the medications that we use against HIV, we call them antiretrovirals. Okay, because HIV is a retrovirus, and they are against that particular type of virus. So over the last several years, there were several factors that were identified to help with compliance of medications. In the early days of the cocktail regimens, people were taking 12 different pills 2 to 3 times a day, so the pill burden was a significant factor influencing whether or not someone was compliant. And if someone's not compliant, then they're not going to be taking their medication regularly, which could lead to resistance. So it is a combination of 2 medications. So it essentially takes the medication count down from 2 down to 1 by combining them.
And I heard that we're also now starting to use Truvada for those individuals who are not HIV infected to prevent them from becoming HIV effect. Is that true?
Yes, that's right. Truvada has a couple of different clinical indications, a couple of different reasons why you would prescribe it other than HIV. One is it treats hepatitis B, so that combination treats hepatitis B. And what you just alluded to is the use of Truvada to help prevent sexually acquired HIV infection. So, basically the thought is to get the levels of the medication in your blood high enough so that if you're exposed to it, the virus is immediately destroyed.
And one quick question also in regards to Truvada, how accessible is it for someone perhaps who has a partner that's HIV and you're not? How accessible is it for them to be able to get a prescription for Truvada?
Well, first of all, you have to go to a doctor because it is by prescription. The second thing is that the doctor has to be familiar with and comfortable with prescribing that particular medication. There are a lot of doctors who are just regular primary care who, feel like HIV care is way too specialized, and so they will opt to, not prescribe something and then possibly refer that patient to an infectious diseases specialist or an HIV specialist. As far as cost, you would need insurance because the cost can be anywhere from $1,500 to $2,000 a month.
And is this something that they should supposed to take every day, once a week?
This is a daily pill.
A daily pill.
Yes,
okay.
Exactly.
Okay.
So the strategies are to make sure that the patient is taking it on a daily basis, because if they're not taking it, then it does not confer the protection that they would need.
Okay. Thank you so much for sitting down with us. We really appreciate it. My last question is, where do you see from a medical standpoint, where we're heading as far as finding a cure for HIV?
Well, I think one of the speakers in the introduction alluded to this. This is probably one of the most promising periods as far as finding a cure. We obviously have a lot of data that we can fall back on. We have the Berlin patient who is the only known patient to have been cured. So we can extrapolate from those experiences, and some of the medications that are coming through the pipeline. I'm pretty convinced that we're close.
We're close.
Yeah.
Thanks so much for
Thank
sitting
you.
down with Urban Socialite. I really appreciate it.
Thank you.
Like I said, this is just one of the workshops that we're going to be attending today. There's actually, I believe, 2 more that we're going to sit down with and find out more information. And I hope the information that Dr. Hawthorne shared with us can benefit someone that's paying attention to what we're talking about today. Till then, have a good one.
30 years since HIV and AIDS, we have come a long way in treatment for those living with the infection, but yet have not achieved a cure. At NAESM, we appeal to our African American brothers and sisters to be serious about knowing your HIV status and get tested today. Know your status. It takes 20 minutes for the oral quick rapid testing to be administered. Knowing is half the battle. And remember, we love you, love yourself, and most importantly, practice responsible sexual behavior.
And we're back, and this time our guest is Gary with a T. You probably know him best from the Ricky Smiley Morning Show. Thank you, Gary, so much for sitting down with Urban Socialite. We really appreciate it.
James, you're welcome.
So tell us what brought you to the workshop this morning.
Well, I was part of the, the co-host with Michelle here. I've done a lot of work with Greater Than AIDS, and so they were part of this workshop, and they asked me to come speak. And I said, well, of course I'd like to come speak because, I'm new here to Atlanta. So I thought, what better than to come, put myself out and, meet the people like yourself here today at the workshop.
So tell me, what did you want to get from the workshop, or what did you want to present to the people at the workshop?
Well, one of the things I want to present to the people here at the workshop, number one, is that, people need to be aware of, HIV and, and the changes that HIV has, gone through. I mean, like I said, it's been 30 years now, and I mean, it has changed tremendously. I mean, the different medicines. I mean, now like we had one guy in the workshop said that he was taking like 40 pills, and now he's down to 5. So that is definitely a blessing. You know, I've had many of friends, you know, to pass from HIV/AIDS. So my thing is, what's better than to be here to help, you know, spread the word. And you know, and I learned some things, you know, too, that you know, that people been HIV for some people been HIV for 28 years. So that goes to show you that, you know, that is definitely a blessing. You know, 28 years and still here, and with the medicines changing like that, that is definitely a blessing, and that gives me hope. So you know, that's what I'm blessed.
And we've come up with so many different ways in order to reach out to not only the older people but the younger people. Now that we're coming to the close of 2012 and going into 2013, what suggestions do you think as we as older ones can give or encourage the younger generation that's coming up as far as getting tested, knowing their status, taking their meds, you know, things like that? How can we, or what do you think you can do, especially in your field, to further that cause?
Well, first of all, I want to say this: older ones, we older. I'm 20, but I mean, you said, I mean, you know, to people, kids, they should know, you know, take your medicine every day. You know, you should be able to, you know, take your medicine every day. Continue to practice safe sex. I mean, because still there's not a cure yet for HIV, but there's still, I mean, you know, it's getting better, but it's still not a cure. And that, you know, people should govern themselves accordingly. They should, you know who they are, you know, and just live right, be happy. I mean, when you walk around being sad and a miserable attitude and stuff, that doesn't help. I mean, you know, just have a positive outlook toward life. You know, that's what I think, you know, more people should do too. You know, should just it's simple.
And now on the more fun side, tell us a little about what's going on with you with the coming year.
Oh, well, you know what? My new year, I hope and pray to God, if you're listening to Urban Social Life, if you even read Urban Social Life, if they ever put me in this magazine, all I want, Lord, is just a nice guy. I'm not asking for much. He just needs to have his 2 front teeth, and he just needs to work. He could work at Jack in the Box, but working at Jack in the Box, I'm letting you know this. If you've been watching and listening to this, you got to be nice to me, though. You're not going to work at Jack in the Box, honey, and think you're going to screw me and other cons, honey. That ain't happening, honey. You will not do that. So if you're going to work at Jack in the Box, honey, you're going to still be nice to me, and we're going to work together. So that's one of the things. And another thing in the new year, I just want to, you know, continue living happy. You know, just have a happy life and stuff. Meeting people like yourselves and stuff like that, and just be free. I mean, that's all I ask for.
I tell you what, since you say you're trying to meet someone, we're going to be having, actually, we're going to be hosting what we call our pre-Christmas party this year. And it's going to be a house party, but we got a few people, probably about 50 people. You're more than welcome to come over.
Really?
And give you a chance to meet some other
Well, you're going to give me the information?
I'm going to give you the information, and you're more than welcome to stop by. It's this Saturday on the 15th.
Oh, honey, I'm in town.
Okay.
Oh, bitch, I'm going to be there.
Thank you so much
No,
for sitting down
thanks,
with Urban
thank
Social
you
Life
so
and supporting us, and we're definitely going to be supporting you.
Yeah.
We really appreciate it.
Yeah, so
Somebody has another question. What you say?
Where's the show? Where you listen to the show at?
This show is on the Ricky Smiley
I'm
Show.
on the Ricky Smiley Morning Show, and you can watch me every night on Fox on Dish Nation. That's DISHNATION, Dish Network, Dish Nation.
So there you have it. We're going to go ahead and let him go on to the next workshop, and we're going to go to the next workshop, and we'll be back.
Welcome to my block party. Glad you can make it.
The only triple doubles you get come with fries.
Last time you blocked someone, you were online.
I can do this all day. Your moves are just gay.
Using gay to mean dumb or stupid, not cool.
Not cool.
Not in my house, not anywhere. It's not creative, it's offensive to gay people. And you're better than that.
And we're back. We just finished the morning session, and now we just had a wonderful lunch. And during the lunch session, they had like an open mic to the people who are attending the workshop. And one of the individuals that stood up and touched us was Travell. And I'm going to let Travell introduce himself and tell you why he inspired us during lunch.
Okay, my name is Travell Ambrose. I'm originally from Philadelphia, Pennsylvania. I am I've been positive for about 23 years now. I found out on my 21st birthday. Being positive for me has been a challenge. Has been a big challenge. I had issues with my family. I had substance abuse issues, I had mental issues, but I've overcome a lot of things. And I feel that for me, when I became HIV positive, I was very devastated. I lost contact with my family for 15 years. And it was just a lot I dealt with. I got on drugs and homeless. I've done a lot of bad things. But in spite of my bad, a lot of good came out of my bad. For the last 15 years, I had 0 T cells. I had a very high viral load, but right now, my T cells are 975, and I'm undetectable. I'm under 20, so everything is going well. And I think, and I just tell my friends that if I never would have became HIV positive, I wouldn't be doing the things that I'm doing now. I'm very active. The Ryan Mike Planet Team here. I do a lot of things. I belong to a group of Atlanta called the Elite Society of the Undetectables. I developed my own program for African American churches that have HIV ministry to help them to develop effective ministry within the church. And my program is called the Prodigal Project. I mean, HIV has been a good thing for me.
So Trevon, we know that right now one of the I guess slogan that we're trying to get people to do is to go out and get tested. What made you go out and get tested?
Well, actually, I got sick.
Okay.
I got sick. This was in 1990. My partner, who had died from it. And you know what, it's funny because you never think it's going to happen to you. And I knew my partner died from, but it's not going to happen to me. It never happened to me. But then it did happen to me. And I didn't deal with it. I found out September the 16th of 1990. It wasn't until 5 years ago I finally accepted my HIV status. I had done speaking engagement, told the whole world, but you know, it's one thing as admitting it and accepting it. But once I accepted it for myself, my life got much better.
And another thing that we've been talking about too is we were in a workshop earlier this morning talking about the various different meds and how Truvada has become really popular as far as even getting individuals who don't even have the virus, keep them from getting the virus if they were to come in contact with it. Now, as far as your meds, I know way back then, the meds were totally different from what they are now.
Totally
Tell us a little bit about that.
I can remember at one time, I was taking like 40 pills a day.
40?
About 40 pills a day. It was like 7 of this pill, 7 of this pill, taking 2 in the morning, some in the afternoon. I know I was taking at least 40 pills total for one day.
And what did that do for your body?
Well, I was sick all the time. Just a lot of emotions going through that. Sick all the time, everything's speeding. But it's just funny how over the years how the medicine has changed. But one thing for me, when I came here, I had lost contact with my family. My family had nothing to do with me. So in the beginning, I was not complying about taking my medication. I ain't gonna lie to you. I got on drugs right here because I did not care. They told me I was going to die, so I was going to die. So I was going to enjoy the rest of my time I had left. They gave me 6 months to live. I'm being honest. And here it is 23 years later, and I'm still here.
And how many people, how many meds are you on now?
I'm on 5 pills. I'm on Truvada, Norvir, Resistant, and Essential.
So we went from 40 to 5. Wow.
But you gotta realize, some of those pills are like combinations of medicines in one, but still.
You only have to swallow 5, not to swallow 40.
One time a day.
So God is definitely good.
But you know what, my attitude has changed. And I tell people, I had to go through my drug abuse, all the things about homelessness. I had to go through these things to make me become the man I am today. And I thank God for that, because I can tell my story to someone else and help someone else out.
So in conclusion, what words of encouragement would you give young people as far as getting them to get out and get tested? If they did get tested, they found out that they were.
The first question I would tell them, be true to yourself. I tell them, be true to yourself. Don't ever think that it can't happen to you, because I thought the same thing, but it happened to me. Be careful who you be with. Ask questions. Ask questions. Don't be ashamed of your HIV status. Don't be ashamed. I mean, just be true. And if you do test positive, it's not a death sentence. You're gonna go through those emotions in the beginning, But overall, you can overcome. I have overcome so much. If I can tell you my whole life story, some of you guys will be surprised. But we're not going to go into that detail. But I'm telling you, I've overcome so many obstacles in my life dealing with HIV. And I tell people, it's a good thing that I became HIV positive. People think that I'm crazy when I say that, but it has been a blessing for me. I'm doing more things now that I'm HIV positive that I think I would have been doing if I wasn't positive.
That is really great news. Thank you so much for sitting down with Urban Social Life. We really appreciate it.
Thank you so much.
Now, what's the workshop you getting ready to head to? You don't know yet? I know it's a total of 3.
One of them is the Masters or something.
Okay. We will stay tuned because there's going to be more to come.
Gaining weight was easy. All I had to do was sit down and eat. Losing weight's a lot harder. I have to work at it every day. But with every step, I lower my risk for type 2 diabetes and heart disease. And that makes every step, every choice, every day very much worth the effort.
Learn how you can help stop diabetes by losing weight, eating healthy, and staying active. Visit checkupamerica.org or call 1-800-DIABETES.
Hello, my name is Katrina Howard. I'm from the Coastal Health District and I am a communicable disease specialist.
Hi, Latoya Golden, Gwinnett County Health Department, STD Supervisor.
Hi, I'm Gerald Richards from the DeKalb County Board of Health. I'm the STD Prevention Coordinator.
I really enjoyed myself here. I came here to learn, understand more of the MSM population and how it can benefit our district. And I think I definitely got that when I came here, so that was great.
I think it's been an awesome symposium thus far. We've learned tons of, ways that we can better connect with the population that we serve. So I'm just ecstatic about having a forum such as this, just to come together and talk about the issues that matter to our community.
I think it's been a great, solid first step, dealing with this part of the community. We try to break down some of the barriers so we can understand where they're coming from and help them understand where we're coming from while trying to get our jobs complete, which is very important to the overall health of the metropolitan Atlanta area.
And the big question today that we're finding is, what way can we get the message out for 2013 outside of all the other ways that we've been doing up until now?
Well, I will say this. Linking up with the MSM population in the rural area has been a challenge. We don't have CVS. So I learned today that we're just going to have to get out there, go out into the community and do the work. And it takes volunteers. Because public health doesn't have the funding to pay people to do it. So we're going to just have to go out into the community and strongly educate them.
And what about taking away some of that fear that we're learning in some of the workshop? People are saying that when they see AIDS Atlanta or things like that, they instantly think AIDS, or they shun away from it. How can you think we can start drawing people more and not being afraid of it?
I think, the answer is we have to normalize testing. Everybody needs to think of testing as a part of their, everyday health care. And, getting an HIV test should be the same as getting, a test to see if you're diabetic. And so we just have to start normalizing, HIV testing. We have to talk about it more. We have to be more accepting. We have to try to eliminate stigma wherever possible. That's what it's going to take. Everybody has to get on board.
And how can we reach out more to the young generation that's coming up to make them see the importance of getting tested, and if they the importance of getting tested and also doing their treatments if they find out that they are?
I think we have to start building bridges to the younger generation. Normally it's always a generation gap. Now that you can control gaps, you build bridges. And that's something that we have to be creative with in nurturing, building bridges to the younger generation and let them know we're not here to harm you, we're not here to hurt you or scare you. We're here to help you, but we have to find a way to open that up where they're more comfortable coming to us and we're more comfortable coming to them as well. So we need to bridge that gap. We have to find a way to bridge that gap.
Great. Thank you guys so much for taking out the time to talk to Urban Social Life. We really appreciate it. Enjoy the rest of your day.
Thank you.
All right.